Now we're going to be administering sub-Q medication. This is insulin in specific. Our sites for insulin is the abdomen, at least 1 inch from the navel, the anterior upper thigh, the posterior upper arm, the upper back over the scapula, and the upper butt or lower back here. Our reason for rotating injection sites is so that the tissue stays healthy and doesn't become hardened, because then it's harder for the medication to absorb the way it's supposed to. So today we're giving insulin to a patient. We are ordered, it's a routine medicine every morning for this patient. 10 units is what the doctor has ordered. Since we're going to be giving it in a insulin syringe, there's no need to convert into a different dosage. So we're going to be going with the insulin syringe. So first what we're going to do is we're going to check the doctor's orders, and we're going to check for the patient's allergies. And then we're going to perform hand hygiene, and this is now where we would go and calculate the dosage if there was anything to calculate. But since the doctor has given our dose in units, and we're going to be using a insulin syringe. So then we would get our medication. We would look and see make sure, verify with MAR that this is the insulin that he's ordered. We would then check for any contaminants, and we would check for the expiration date. We'd check and make sure everything is good with the top here. There's a plastic cover on it. And then we would take our alcohol prep pad, and we would clean in circular motion for 30 seconds. We would let that dry. We would get our insulin syringe ready. He has ordered 10 units. So what we're going to do is we're going to aspirate 10 units of air, and then we're going to inject this into the vial of medication. Same thing, hold this like we would our pencil. Inject 10 units of air. We'll flip it over. We can look for contaminants again to make sure. Okay. Now, what we would do is 10 units. Now what we would do is lay the cap down and recap it, because there's no way to change these syringes. This is a high alert medication, so we would have another nurse check our dosage amount to make sure we are going to give it correctly. Then we would check our vial of medication again to make sure that we have the medication that the doctor has ordered. So then we would gather our supplies. We would go into the patient's room, and we would ask the patient to identify themselves using their name and date of birth. We would check their ID band as well. We would then perform hand hygiene. We would recheck their allergies to make sure. We would put on gloves, and then we would continue to administer the medicine. We would position the patient in the correct position. We would provide privacy for the patient if needed, and then we would take our alcohol swab, and we would clean the injection site for 30 seconds in circular motion. We have to check our medicine 3 times before we administer it, so this will be the last time we checked our medicine to verify that it is what the doctor has ordered. Then we would take our syringe here, and so we would continue. Since this is sub-Q injection, we would have to pinch up the skin. We could go in at a 45-degree angle or 90-degree angle, depending on the size of the patient. Here we're going to go into a 45-degree angle. We're going to inject it. There's no need to aspirate with sub-Q medications. We would pull it out, and then we would recap, or we would not recap the needle. We would throw this away in the sharps container. And then what we would do is we would take our alcohol prep pad. You do not massage sub-Q either. So we would pat this if there's any blood or anything, and we may hold it over or put a Band-Aid if we need to, if there's blood. And so then we would reposition the patient where they're comfortable. We would take our hands, our gloves off, not our hands. We take our gloves off. We would perform hand hygiene. Then we would check or look at the MAR. We would date and time our medicines, and we know that this is safe given this medicine because it is a routine every morning thing. So we know that this is given once a day and it's given in the morning. So we're safe with the amount that we have given and the time we've given. We would come back and check on the patient, see how they're doing, and that's all.